Okay, so next we're going to administer a feeding with an NG tube. So we're going to gather our equipment and we have to make sure that we have the correct formula, check the expiration dates, make sure the order is correct, the frequency of the medication, everything like that checks out and everything's good. Perform hand hygiene, make sure we have the right patient. We just want to make sure that the amount, the concentration, everything like that is great and good to go, and that we have checked the medication records with allergies and everything like that. Whenever we go to the patient, we want to explain the procedure to the patient and make sure that the patient is aware of the procedure. Double check for allergies because not always are the allergies correct in the patient's chart, and you just want to make sure that the patient is aware of everything that's going on, because sometimes they might be frightened. So just make sure that they are comfortable and that they are a 45-degree angle. So you guys can see me very well. Okay. And that they are at a 45-degree angle, from 30 to 45-degree angle, as much as they can be. You just want them in a normal eating position. And then there are 3 ways that you can do a tube feeding, or an NG tube feeding rather. And once you don't want to do this until you check that the NG tube is in the correct position. And we have already done that. And so I'm in the patient's room, all my equipment is gathered, everything's good to go. The placement has been checked. I've already aspirated the content in the patient's stomach, went ahead and flushed the tube back through, so everything's good there. And we actually, there are 3 ways that we could do this feeding. So there are some open system feedings and then some closed system feedings. So we can go over the internal feeding pump first. That one's the big one. So in order to do the closed feeding pump, you're going to, it's a close flow regulator clamp on the tubing, and fill the feeding bag with the prescribed formula. And then whenever you are done filling the bag with a prescribed formula, you are going to put the date and time on it, make sure that the patient's, it does match the patient, you check the patient's identifiers and everything like that. You label the container with the patient's name, date, and time with the feeding tube, and you hang it. And you want to hang the feeding tube on the IV pole, and this is going to allow the solution to run through the tube. And you want to hang it 12 inches above the patient's stomach for all of the feedings, and you're going to connect the feeding pump following the manufacturer's directions and set the rate, and you want to maintain the patient in the upright position through the feeding, that way that they don't get choked or aspirate or anything like that. That way, and just gravity takes over and just keeps pulling it down. If the patient needs to lay flat temporarily, if the patient needs to lay flat temporarily, you can pause the feeding and then resume the feeding whenever the patient sits back up. So that is an option there as well. You need to make sure that you're checking the placement of the tube, of the NG tube, every 4 to 6 hours, though, to make sure it's not falling out of place or anything, because again, you do not want the feeding or anything going from the NG tube into somewhere that it's not supposed to be. You want to make sure all the content that is supposed to be going to the stomach gets to the stomach. Otherwise, you could have some serious issues. You want to observe the patient's response to the feedings and document in real time, and then have the patient set up in an upright position for at least an hour after the feeding, and that is for the internal feeding pump. Now, if it were a large syringe feeding, and this is your open system feeding, after the feedings are done, you want to make sure that you flush for any feeding before you do them. You want to make sure that you flush the NG tube before you start any feeding. Just like I said before, any medication, any feeding, anything, you make sure that the tube is clean and ready to go for that. But you're going to do that after you check the placement of the tube anyway. Once you aspirate, you want to make sure you flush after. But just make sure you flush before you check, before you start any type of feedings, as well as any medications. And then for the large syringe, which is an open system, you want to remove the plunger, and you want to, this is going to be from 30 or 60. You want to get the big plunger, and you're going to attach that plunger to the NG tube. Where did my plunger go? I don't have a big one, but I have this one. So let's just pretend like you attach it to the NG tube. And what you're going to do is you're going to, after you flush it and make sure that your lines are clear and good to go, and they're flushed, you're going to check and make sure you have the right formula and everything, and you're going to pour the contents of the formula into the syringe. You don't want to push the contents into the syringe or anything because you don't want to make it go faster. You just want gravity to take over and slowly just pour or go into the patient. So whatever the prescribed amount is, you would just continue to pour until that prescribed amount is all into the patient, and the patient has absorbed all the nutrition and everything. But this way it kind of gives the patient gravity, kind of gives it a little bit of a slower than if you were to push it. You do not want to push an open syringe feeding. And then if you're using a feeding bag administration system, that's also an open system feeding, you're going to label the bag with the date and the time, and then you want to hang it on the IV pole, and that's going to be about 12 inches above the patient's stomach. And then you are going to clamp the tubing, and you want to check the expiration date and everything as we have before. And you want to clean the top of the can of formula before you open it, and make sure that it is clean and ready to go, disinfected. Pour the content of the formula into the bag, and then you're going to allow that solution to run through the tubing, and then you're going to close the clamp. Attach the feeding administration set to the feeding tube, and then you're going to open the clamp and regulate the feeding. So you just want to make sure that it's not going too fast or too slow, so you're able to regulate the speed of the feeding whenever you are doing the bag feeding, because you can set the rate of it. So you want to add 30 to 60 mLs of water for irrigation to the feeding bag when the feeding is done, because gravity is taking that over. Sorry, I'm getting confused with the two. Gravity takes over the feeding bag system, so you can't regulate the time. That's the internal pump. I'm sorry. So gravity is taking over this feeding bag system. That's why you flush it out. But you want to hang it 12 inches above the patient's stomach, so that way gravity takes it over. And you want to make sure that the bag is clamped once it starts. That way you don't have solution running everywhere. Once everything is good and ready to go, and then you want to make sure that after the feeding that the clamp, you clamp the tube and you cover it, because you don't want any foreign objects or particles or anything getting into the NG tube, because you don't want the patient to suffer from any infection or bacteria that might get into that NG tube. After the feeding, make sure you flush it with 30 to 60 mLs of water, and make sure the patient sits upright for at least an hour or so to make sure that they are good to go, and make sure they are comfortable, and document in real time hand hygiene before you do all of this, and make sure the patient does not need anything before you leave.